RiverMend Health is a company that's focused on behavioral health, most specifically on addiction and eating disorders, as well as obesity. It's hard to say that there's any more pressing public health problem in the United States today than drugs of abuse, drug misuse, and addiction. And so that would be a problem that affects people from the age of 6. I've seen 6-year-olds with problems. And now we even have problems of newly born, who are born addicted, to the very old. And even in elder communities, the number one problem tends to be alcohol, and sometimes number 2 is STDs. So it's a common problem that's undiagnosed, untreated, until there's a physical complaint or an accident. Car accident, a fall, a slip, some kind of trauma. And oftentimes people come to treatment when it's too late. So it's a chronic, lifelong relapsing disorder that's the most common untreated medical illness in the United States. So I'm a professor at the University of Florida, and I've spent my career doing addiction research and what's called translational research, which is taking ideas from a concept stage to develop treatments that help people. And I've done this, I'm almost embarrassed to say, since 1972. So my first publication in the field was whether amphetamines would help your memory, and what's the role of sleep and memory consolidation, and moved on from there to new treatments for opiate addicts, new understanding of cocaine addiction, and most recently how foods, especially manufactured foods, cause addiction-like complications in the brain. How do I see RiverMend Health growing? There's a tremendous need for services that's unmet throughout the United States. So new treatment development is very important, and evidence-based treatment is very important, as well as treatment in a variety of different settings that might be put together to give you a long enough time in treatment to really make a difference. And I think Dr. Harris and the other leaders of RiverMend Health have thought about outcomes and long-term treatment and chronic disease management, thinking about addiction like kidney disease or diabetes rather than thinking about addiction like a broken bone, something you just fix and the person's gone. Rather than that, it's a lifelong process of active relapse prevention and positive outlook and treatment. Dr. Harris and the rest of the leadership group at RiverMend Health asked me if I could put together a scientific advisory board. And I'm the chairman of that scientific advisory board. And we brought together the nation's experts in laboratory research, new treatment development, treatment outcomes research from big cities, little cities, state-impaired programs, airline pilot programs, professional athlete experts. And I think that's a defining characteristic of RiverMend Health, and also something that sets them apart, listening to experts, asking people's point of view, saying, what have you learned in your career in treatment that we can use to help people? So the act of listening and having a scientific advisory board, giving input and making themselves available to make a difference, I think is very important. So that means not ignoring science or scientists, not ignoring the medical literature and proof of practice. So there are procedures and widely recognized among academics and researchers like myself, ways to do things. How do you intervene with someone who has an alcohol problem? How do you treat someone who is cigarette smoking? What do you do with a young person who's smoking pot all the time? There's evidence, meaning data in the literature, peer-reviewed literature, not someone's diary or just statements. Actual data and literature, that's evidence. Now, what you do with that evidence is a different story. You can say that's evidence and ignore it in your treatment practice, or you can say that's evidence and make treatment that takes advantage of the evidence. And I think that's really been the goal of RiverMend Health, to take the evidence and make treatment that respects the evidence and uses it. So our own research work has shown pretty clearly that if you were to take a physician who's a drug addict, even a physician who's using drugs intravenously, even a physician who's using drugs intravenously and passes out in the middle of surgery, and you put that person in a treatment program, whether it's University of Florida's treatment program or another treatment program, and you say, okay, we stabilize the patient, we evaluate the patient for medical comorbidities. Do they have hepatitis? Do they have, and so forth. You treat those, you detoxify the patient, and then what? So the then what is the residential treatment program, the partial treatment program, the intensive outpatient treatment, the outpatient office program with urine testing and outcomes measures, and for 5 years you find 80% of the physicians are drug-free, back to work, and fine. My goal is to make the kinds of treatment that is widely available to physician addicts and pilots available to everyone else, and I think that's a goal. Drug misuse, drug dependence, drug abuse is the nation's #1 unmet health problem. So we've done a pretty good job of meeting the needs of people who develop breast cancer. We can do better, but we've done a pretty good job. We have tests, we have gene arrays, we have treatment, evidence-based treatment approaches, and breast cancers, like when I was in medical school, that we would expect the woman would die within 5 years, they live well beyond 5 years. So we made a really big impact. For addiction, it isn't really the same thing. Treatment is delayed. People have fears about their illness and telling other people, and their stigma, and so what happens is most of the substance abuse problems are ignored, denied, under the surface, not diagnosed. And there's even recent study to show that even if they went to a doctor during the 1 year before they entered a drug rehab, the doctor didn't know. No one knows. So it's untreated, chronic, festering, and affects everybody in a variety of ways. So if you stay in a hotel and somebody's smoking drugs, it's coming into your room. If you're in an apartment building and somebody's smoking drugs, it's coming into your apartment. If you drive a car, you're impacted by drunk drivers and now drugged drivers. If you have insurance, it's impacted because of the effects of drugs on various diseases, from intravenous use from HIV to Hep C. I think Ryan Harris would be better to talk about it, but from the point of view of people working in the field, Norwest Venture Partners is a large firm, and by choosing addiction medicine to invest their investment dollars, it says that addiction medicine is a field that has great need, now newly identified evidence-based practices, and there's some way that Norwest can marry with universities and experts and develop treatment programs that are both novel and cost-effective.